COVID-19 is not only a respiratory infection, it is also a vascular disease. The virus attaches to ACE2 receptors, which are found in blood vessels throughout the body. When the virus enters these cells, it triggers inflammation that damages vessel walls. This process, called endothelial dysfunction, weakens arteries, increases clot formation, and disrupts blood flow. Because the brain depends on constant oxygen supply, any blood vessel injury increases the risk of stroke. COVID also affects the immune system, creating a massive inflammatory response called a cytokine storm. This causes swelling, clotting abnormalities, and organ stress that can directly contribute to stroke. Because the virus affects multiple systems, patients remain vulnerable even after their respiratory symptoms improve. One of the most serious complications of COVID-19 is hypercoagulability, an increased tendency for the blood to clot. The virus disrupts normal clotting mechanisms and increases proteins that promote clot formation. These clots can form in the legs, lungs, heart, or brain. When a clot travels to the brain, it can block an artery and cause an ischemic stroke. Some patients develop large vessel strokes, which are particularly dangerous and often occur in adults under 50 who had no previous risk factors. Understanding the clotting effects of COVID is essential for early prevention and treatment. COVID-19 triggers widespread inflammation in the bloodstream. This inflammation increases blood pressure, damages arteries, and accelerates plaque buildup. Inflammation also weakens the protective lining of blood vessels, making them more likely to rupture, a possible cause of hemorrhagic stroke. The body's attempt to fight the virus can inadvertently cause the blood to thicken and become unstable. In severe cases, inflammation spreads to the heart and brain, creating dangerous conditions for stroke. Managing inflammation is key to reducing stroke risk during and after infection. COVID-19 can damage the heart muscle, trigger arrhythmias such as atrial fibrillation, or cause myocarditis, heart inflammation. When the heart does not beat properly, blood can pool and form clots. These clots may travel to the brain and cause stroke. Even mild COVID can temporarily weaken heart function. Patients with existing heart disease face the highest risk. Monitoring heart rhythm, blood pressure, and chest discomfort after COVID infection is essential to prevent stroke. Before COVID, stroke in young adults was relatively rare. But during the pandemic, doctors observed a rise in stroke cases among people aged 20 to 45. Many had few or no traditional risk factors. COVID-19's effects on clotting and inflammation are the primary reasons. Some cases involved large vessel occlusions, strokes that block major brain arteries, and require urgent treatment. Younger patients often delay seeking help because they don't expect a stroke at their age. Awareness is critical to prevent severe outcomes. Some people experience stroke weeks or months after recovering from COVID-19. This is because long COVID causes chronic inflammation, persistent clotting abnormalities, and lingering blood vessel damage. Fatigue, brain fog, headaches, and shortness of breath may mask early stroke symptoms. Post-COVID patients should monitor new neurological symptoms carefully. Doctors often recommend follow-up blood tests and imaging for those with long-term complications. Understanding delayed effects helps individuals stay alert even after initial recovery. The risk of stroke after COVID-19 is highest in individuals who have hypertension, diabetes, high cholesterol, heart disease or AFib obesity, autoimmune diseases, history of stroke or blood clots, severe COVID infection. Older adults are especially vulnerable but even young people with no prior conditions can experience post-COVID strokes. Recognizing who is most at risk helps guide early monitoring and prevention. Stroke symptoms after COVID are the same as traditional strokes. Use the FAST rule: face drooping, arm weakness, speech difficulty, time to call emergency services. Other symptoms may include dizziness, vision loss, numbness, confusion, severe headache, or collapse. Post-COVID patients must treat any sudden neurological change as an emergency. Early treatment is crucial because COVID-related strokes can progress rapidly. Prevention focuses on reducing inflammation and controlling clotting risk. Patients should stay hydrated, monitor blood pressure, maintain healthy cholesterol levels, control blood sugar, avoid smoking and heavy alcohol, Exercise regularly. Doctors may prescribe blood thinners or anti-inflammatory medications for high-risk patients. Monitoring oxygen levels and heart rhythm after infection is also important. Lifestyle changes and medical guidance work together to protect long-term brain health. COVID-19 increases the risk of stroke through inflammation, clotting problems, and damage to blood vessels. But understanding these mechanisms allows people to take proactive steps. With proper monitoring, medical treatment, and healthy lifestyle habits, the risk of post-COVID stroke can be significantly reduced. Awareness saves lives, especially for those recovering from infection or dealing with long COVID symptoms.